almost made it. I welcome in this morning. We're going to go through and just let everybody introduce themselves. We're going to start with Dr. McCullough.
So, Mary McCullough, I'm family practice here in Decatur County. Been here for a long time, and I've been working with the community health clinic, so we've got some announcements.
We do.
I'm Lindsay Job. I am a family nurse practitioner here in Decatur County as well, born and raised here. I have experience in a few different places, geriatrics, primary care, and now I'm actually working in hospice and palliative medicine, and I'm excited for what's to come.
Yeah, I'm Desiree Moore, and I work with the Decatur County Sheriff's Department with the crisis intervention team.
All right, well, we're here on behalf of the Community Healthcare Clinic. So a project we've been working on, it seems like for years, but it's really not even been a full year that it has taken to come to fruition. And so we announced this morning we'll be hosting our first mental health clinic on Monday evening. So we're very excited about this. And Lindsay, I'm going to let you kind of open it. We started this, probably a year and a half ago, talking about it.
I was thinking about that. So I remember it probably was about a year and a half, 2 years ago when this process started. So we were contacted by the Decatur County Community Foundation about an opportunity for the Lilly Endowment Fund, which is where they decide who the recipients are for different mental health grants to enhance mental health services in communities throughout Indiana. So I remember us getting together, actually, sitting at a computer talking through kind of what a proposal for a community mental health clinic looked like, and then also partnering with the Decatur County Sheriff's Office, and they've done a wonderful job developing the crisis intervention team. So looking forward to that partnership in the future too.
We're excited. Dr. McCall, how long have you been with the Community Healthcare Clinic? For as long as I remember.
As long as, I remember back in the very early days. So whenever I think it started, I think I was part of it. I don't really know. I think Dr. Domingo was actually the medical director at the beginning. My partner when I came to Greensburg, and then I took that over at some point there. So
we're excited to launch these services. And so the Community Healthcare Clinic serves those that are either not insured or they're underinsured. And so we've had a lot of discussion about underinsured and what that looks like. But as we've talked in the past, a $3,000 deductible or higher, that kind of gets into that point where you just sometimes can't afford it.
Well, and I think with the new changes that have come about with not having the affordable care funding that some people were getting help with, their choice was to keep insurance, they had to go to a very high deductible. So a $5,000, $10,000 deductible is not unusual for people, and that's just out of reach for a lot of people to be able to come up with that.
We do follow the WIC income guidelines, which are very generous as well. So if you're not sure if you qualify, call us, because come out and see us, because we will find a way to get you whatever you need it. We find a way.
Mm-hmm.
So we also do dental services, we do medical services, but the mental health is our launch is coming. And when we've kind of looked as a whole, and Desiree, you've been very involved with CIT and the Lilly Grant and all of that, the need in our community for these services is just astonishing.
Yes, we're seeing those gaps. If people are coming out of treatment or maybe their therapist has left, you're sometimes in that gray area where I'm trying to get back into an established provider, but maybe I have this small gap of time where I need to be seen and maybe get medicine or a brief therapy session, and this is going to bring this to the community. It's been needed for so long. I'm so excited for that.
I think it's been really neat to watch you grow this role with CIT as well. You've been able to formulate a lot of relationships for those people that may need a little bit more intense than what we can offer in one night, but you've made those connections with some of the out-of-county treatment facilities.
Yeah, we have great partnerships with community mental health in Lawrenceburg, Columbus Regional Hospital, and getting those treatment, Indiana Treatment Center for substance use. That's been astonishing for our community and getting the help they need. Already today we've had 169 calls since January for the CIT team, and bridging those gaps with resources and getting folks help that they need is what we're here for.
So as we are ready to launch into Monday night, we'll all be there. So we've got resources in place. Felicia Wiki is my assistant that works out there with me, and she's working on scheduling, and she handles the in-house resources that we have as well. And, I think it's important. People say, well, I can't afford them. If I go, I can't afford the medicine. I can't afford to go to a treatment. But we're all kind of skilled in that finding the ways, right?
Right.
That's what
We will
do.
find you a way.
Yes.
One way or another, we're illegal, but we'll find a way. So as we launch into Monday, Dr. McCullough, what kind of patients do you envision that we're looking for? Or if somebody's out there listening and thinking, am I someone that they could treat?
Well, I think, we all have our days where have down days or, worry about things. But I think when it becomes persistent and really affecting day-to-day life and family interactions, friend interactions, or just stopping those interactions, those are the people that need to kind of think, do I need some help? One, I do want to put a little bit of a plug in because I also work at the Board of Health, but the Board of Health does have a site called Credible Mind that is very nice. Now, it's not going to take the place of an in-person person for actual counseling, but it might really help people see that there's things out there that can help me, or maybe identify that I'm somebody that I ought to think about. Should I be screened? Should I try to seek some help and try to really improve my life to where I can enjoy life? So
I think we talk a lot about what triggers these things, right? And so we're also able to find resources that may help. And I know you guys with CIT have worked very diligently on that. Is it a lack of food? Is it a lack of finances? Is it what is that trigger? So we all, I think, have those resources too to offer that we can get you connected to what you need.
Yeah.
Well, and I think especially the community care clinic is really in tune with that, to be able to have those avenues to direct people to get that help. So,
Lindsay, I know this, you have a very big passion for mental health. So as we get ready to do this, what's this mean? You've been able to be a part of it for, obviously, from the get-go. We created this. What does it mean to you to be able to be a part of it and get ready to launch into this?
I think it's just a dream come true for our community and for all of us, because I think, whether we realize it or not, we all go through difficult times. It's the intensity and the extent of those difficult times and how we kind of rise from the ashes from that. And what I realized in primary care when I was encountering a lot of those folks with mental health issues, it may just take one person to really hear your story and understand. That way you have that safe space and that trust. And I also want to highlight that isolation can be very difficult, but the opposite of that is community and connection. And I think that's so important. I think that's hopefully something that we will be able to offer through that clinic as well. Mm-hmm. So.
Desiree, and you utilize the resources probably more than any of us, but can you kind of go through some of just the different resources we have within the county and even out of the county that are assistive to people that may be needing help?
Yeah, absolutely. Centerstone has been a huge partner for us. There's many independent therapists that have emerged and are helping bridge those gaps where we need. I think those are those services that have been very advantageous for our program.
So as the Lilly Grant has come out and it's sponsoring many different things and getting those funding there, I feel like we've really seen Decatur County really wrap their arms around the mental health piece. And the point is to end the stigma, because if you need help, that's what we're there for.
But we do not want to be interfering. If somebody has a relationship with a family doctor or a family nurse practitioner, they need to continue that as much as that's important. And
Absolutely.
Decatur County Memorial Hospital has excellent providers. So this is really more for people that can't access that because of circumstances, cost or availability, or just, people that fall through the cracks getting out of jail, or something that just can't get into somebody for 3 weeks or something if they're a brand new patient. All that takes time. So
yes, and we absolutely want you to stay with whoever you're with. This is for those that are in need and aren't able to afford it. As we go into this, we're figuring out, we're seeing what the footwork looks like, right? We don't know how often we'll need to have it or how many will come out, and that's what we're going to start Monday and see what that looks like. We're in the Rural King Plaza, so just drive past Rural King and there
Keep
we are.
going. Yeah. Keep going. It's on beyond the Rural King entrance. So
Yes, and we are right there. And some things that people I don't think know about the clinic is we do have an in-house food pantry for patients. So if that you're a single mom and you're trying to take care of 4 kids and you're struggling in general, and then you don't have money for food and groceries, that's something that we help with as well. We work on getting free medications. So last year we secured over $100,000 worth of free medications from manufacturers. So we will find you a way to become independent in what you need. We always say it's a hand up, not a hand out. So
And there's so many factors that are going to come into play. If you have questions, I encourage everyone to come out, and even whatever resources you need, we're there. We're going to be there Monday night. We're excited and we want to help. So if you have a question about your mental health or even just resources, this is a great time to come out and just explore.
we are happy to talk to anyone about anything.
I know some people have a lot of reservations about starting on a medication too, so I wanted to touch on that. Just because you come to the clinic doesn't mean that we necessarily start you on a medication. Maybe you do need resources. Maybe you do need access to those basic needs, and that's kind of one thing that's really getting you down. Or, you just need someone to talk to because everything at home is very dysfunctional. We are going to be kind of that safe harbor, safe haven for you to feel like you can really process what's going on in your life and hopefully get through that in a productive way.
It's the clinic has gone through several name changes over the years, and we're 41 or 42 years into this. But we truly are a community healthcare clinic, and coming there is just like going to any other doctor's office, dentist office. It functions the same. It looks the same. We've worked very hard. Dr. McCall and I have been there through this process of building out, and we're going to build out a little bit more now that we are expanding our footprint. But and both working in a practice, it is just like being at a doctor's office.
I am very impressed with the clinic, having seen it. And has it been 42 years then?
I think it's 42.
So probably I've been involved for 40 then, because I've been in the county for 40 years. So, but I remember back at the beginning, and at the beginning, I think a lot of our focus was helping women with pregnancy. And I think it was Carol Christie that was kind of the one that was really working. That was before there was expanded funding to help make sure women had healthy pregnancies, healthy babies. But I remember our different locations that we've been at, and now we are at a space that's very professional looking, very private. I don't know where all the funding came from, but again, I kind of want to give a prop for Decatur County Memorial Hospital. I think they did a lot of that help with renovations there, and there is good privacy for patients. It's just basically a medical office, so and a dental office. The dental area is great. So
it's nothing to come there. There is nothing attached to that. It's just truly a facility that we're there to provide for. So very excited about it. And I think talking about the Decatur County Memorial Hospital, we work great with those providers. So if you are seeing a provider and you lose your insurance, they're great about saying, hey, you know what, let's bridge the gap till you get it back. You can go here, we can talk to them, let you know what's going on. So if you are in that situation now, feel free to contact us and get in there. And again, it's going to be Monday night. We're going to start at 6 o'clock. And Desiree, that's a great point. If they have questions, just come and talk to us. It can be about anything, because that's what we're there for.
It doesn't necessarily mean you are going to be seen as a patient. You can just come and ask a question. So.
Absolutely. Huge thanks to the Decatur County Community Foundation. They are a very large supporter of this project. And then we are also a United Fund agency as well. So and we have so many private supporters. I wish I had the list with me to go through all of them, but we've been very, very blessed in the last 3 years with just a lot of funding. So very excited about this.
All thanks to your leadership.
Yes,
your direction.
It takes an entire team. I am
and Dr. McCall, of course.
I am one.
Emily and Felicia are the brains behind all this and the push, I think. So.
Without her, we would not be here. She does so much that nobody knows in the background. So, but yes, it takes an entire team, and I try to emphasize that all the time, because it is, without Felicia, I would be done, and she just keeps me in line. But it takes everybody that's there, and I know we have some other providers that are kind of excited to jump on board as well. So we're excited to see what's going to become of it, and we're going to keep talking about it and keep talking about mental health and Des, we're so excited you're going to be able to be with us and,
Yes.
provide some extra resources that we are not so skilled in.
Absolutely. I'm
And
excited.
CIT is now at full staff at this point,
Yes,
right?
yes. We just added our fourth person. Sarah Kelso joined our team, and we're very excited to have her on board.
I think it's important too with CIT. You guys have been instrumental in, I'm going to call it diversions, probably the wrong word, but if maybe an issue is mental health and it's not going to jail, it's maybe not the answer. Doesn't mean there aren't consequences, but getting people to where they need to be.
Yes, yes. At prosecutor's office, the sheriff's department, city police department have all been tremendously on board to help get individuals the treatment they need versus a criminal. You know,
And if you're at home and you're struggling, you can call and reach out to CIT. That you
Anytime.
don't have to be on the path to jail to be able to utilize CIT.
anytime, 24/7. Just call dispatch, and we will get somebody out there to help you.
All right, ladies, thank you all so much for being in here today. Exciting stuff happening once again, April 6th. What are you most looking forward to? Lindsay, we'll start with you.
I think just hearing people's stories more than anything.
Dr. McCall?
I think just being able to fill a need that's gone not met.
Yeah, I'm excited to get those. Anybody who's out there saying, gosh, I really need this, and we can be that answer.
We can find this.
Yes.
Whatever it may be.
Whatever it is.
Yes. Well, I'm very excited. I thank you all for your support, and again, the rest of my team, because it takes all of us and a lot of volunteers that we have come through the clinic. We appreciate every one of them. So there'll be several of us there on Monday night, so please come out and see us. Again, it's Monday, April 6th at 6 o'clock, and I will see all of you ladies there.
Looking forward to it.
All right.
Thank you.
10:20 on Tree Country, 1330.